Well, as we observe National Down Syndrome Day, let's get some more information and advice for families with someone with the syndrome. Well, I am now joined by Nelson Mandela Children's Hospital paediatrician, Dr. Sanelisiwe Balfour, also known as Dr. Nelly. Thank you so much, Dr. Nelly, for joining me this morning. Always great to have you. I think first and foremost, this is a very personal one for you. How does this actually, affect so many people in South Africa, and how is this, I don't want to say it's being downplayed, but it is something that people don't really take so serious in this country as well. Should we take it serious, and how serious should we take this syndrome, basically?
So we should take it seriously. The reason why it's so close to my heart is because I treat a lot of children with Down syndrome, and just to basically cover what Down syndrome is, because you'd be surprised at how many people don't actually know what the condition is. It's actually a chromosomal disorder that affects 1 in 700 children who are born worldwide. So it is quite prevalent, and it's the most common chromosomal disorder in the world, and also the most common cause of intellectual disability in the world. The medical term for Down syndrome is trisomy 21, and as most people know, tri means 3. And the reason they call it trisomy 21 is because naturally every single human being is born with 23 pairs of chromosomes, which is 46 in total. But people with Down syndrome or trisomy 21 have an extra chromosome on the 21st chromosome, meaning they have 3 chromosomes on the 21st chromosome, so giving them 47 chromosomes, which is why we call it trisomy 21. And that's basically the biology and the genetics behind it that causes Down syndrome or trisomy 21. Down syndrome is a syndrome, as its title implies, which means that there's a whole lot of different body systems and different afflictions, signs and symptoms and clinical signs that affect children with Down syndrome, and therefore adults with Down syndrome too. Down syndrome is something that is a little bit downplayed in our communities, because I think everyone knows someone who has the condition but doesn't 100% know what the condition is. And I think if we had a better understanding of it, then we'd be able to, treat people with Down syndrome a little bit better and accommodate them better in society.
So when it does come to our societies, especially the underprivileged societies, how do we then address this issue?
So there are screening tests for Down syndrome that are basically offered in both the private and the public sector. You can actually pick up Down syndrome in a pregnancy as early as 10 weeks, even up to 14 weeks. And I know that in the private sector, there are specific tests that we do to pick it up a little bit earlier. However, we do offer all screening to people in our public sector too. So in our underprivileged communities, we're able to pick it up a little bit better. However, these are screening tests, and once the screening tests usually come back positive or high risk for Down syndrome, we move on to confirmatory tests, which are a little bit pricier. But I think that in terms of our healthcare system, it's accommodating both patients who are underprivileged and those who are a little bit more privileged with medical aid, without medical aid, to pick up Down syndrome a bit better.
When it comes to educational barriers, I think there's, a lot of exclusion when it comes to Down syndrome, people that have Down syndrome. How do we make sure that our communities also know that, it is okay to then include people with Down syndrome, and to make sure that, we don't just discard people with Down syndrome and make them, as something other than part of the society as well?
I think greater awareness of the condition itself. So I think the more we talk about Down syndrome and bring awareness to it, and obviously October is Down Syndrome Awareness Month here in South Africa. So forums like this where we can speak about it and, bring it to the fore so people are aware of it and people aren't scared of it and there's no stigma attached to it, because I do know that usually when I break the news to a parent that they may have a child with Down syndrome, it feels like it's the end of the world for that parent, and that's only because of what they've seen in society and how people with Down syndrome are treated. But I think that children and adults with Down syndrome need a lot of understanding, a lot of patience, a lot of time and a lot of love. There are also a lot of support groups for parents who have children with Down syndrome and adults who have Down syndrome too. And I think once we make people more aware of those support groups and offer them the support that they need, then Down syndrome won't be seen as, people who are other, and they can be integrated more into society.
you don't just work with children with Down syndrome, you also work with adults with Down syndrome sometimes. So, you know, do you think that they also suffer when it comes to society and they're being discriminated against in some way or another?
100%. So I mainly work with children with Down
Yeah.
syndrome, but obviously children with Down syndrome become adults with Down syndrome who need to live a full life just like any other adult does. So they typically tend to be more discriminated against because Down syndrome and a large proportion of people who have it typically have what we call an intellectual disability. So, you know, in terms of development, milestones are delayed, not getting a job, just like anyone else, not being able to fit into society like any other normal adult. So there is quite a lot of ostracizing of Down syndrome people and adults. So, I mean, as I said, I think if there was more understanding of the condition and people were aware that if people with Down syndrome got the extra attention and special needs and care that they needed, they are able to be a member of society that contributes, you know, to society itself and positively, and they're able to give back and be a normal, upstanding member of society.
And we spoke about, you know, the stereotypes and also, you know, the fact that, you know, a lot of people don't know what, you know, Down syndrome actually is and what it means and you know, how you can actually handle, we've spoken about all of that, but do you think in our, you know, when it comes to POCs, people of color, do you think we have a different approach to this in a way?
I think we do, and speaking as a person of color who's worked in environments where there are mainly people of color, I would say there's a certain way we do look at Down syndrome, which isn't the same as, for example, someone who's not a person of color. I think a lot of us, as I said, have seen or known someone growing up with Down syndrome. And in our society and communities, they were kind of seen as, you know, that person and whatever kind of names they were given, which aren't very positive. So I do feel that maybe because of lack of understanding, lack of education, being disempowered, not getting all the information that we need, that we do tend, as people of color, to look at people with Down syndrome in a certain way. And I wish that that wasn't the case. I think we need to embrace it a little bit more because we have seen how extra nurturing with people with Down syndrome can actually be a positive and good thing.
And very lastly, it is, you said October is the month, you know, for awareness for this. From your perspective, you know, how can we as a country basically stand behind people with Down syndrome and make sure that, you know, we create awareness and also uplift those that have this syndrome?
I think talking about it more is a good thing because I think the more people know, then the better it is and the better they'll treat those who have the condition. I also feel like education is key. So the more we learn about things and get to know things that affect other people and not just us, then that's a good thing too. I feel like months like this, which bring awareness to these conditions, is an amazing thing because I do feel that us having this discussion will help a lot of people who either know someone with Down syndrome, have a child with Down syndrome and thought that, you know, this is it for this child, but there's a possibility for them, you know, to do well and be a good, upstanding, contributing member of society. So I just feel like talking about it and awareness and education is the key.
Thank you so much, Dr. Sanelisiwe Balfour. Always a pleasure, you know, having you here in studio. So, and thank you for the work that you do as well. It's always a great pleasure to have you. That is Dr. Sanelisiwe Balfour, the paediatrician, of course, working also with people with Down syndrome, children especially with Down syndrome, and just creating awareness, especially October. If you didn't know, it is creating awareness for people with Down syndrome and making them part of our communities and making sure that they are being uplifted in the way that they should be.